Today, we're talking to couples. Today, I have Amy and Paul here. They're good friends of mine. They actually got married about a year ago, so happy anniversary to both of you. Thank you so much for being here today.
Yeah, no problem.
First, we're going to be asking Paul some questions. He is the T3 in the relationship because Amy is the type 1 diabetic. So, Paul, what did you know about diabetes, anything specifically about type 1 diabetes, before you were in a relationship with one?
Well, I didn't really know much. I knew that it was an autoimmune disease, and that was about it. I didn't know anything about insulin or what effects it had on your body. So pretty little, honestly.
Oh, that's pretty normal.
Yeah.
Did you know anyone at all with type 1 before you started dating Amy?
Yeah. In first grade, one of my classmates was actually diagnosed with type 1 diabetes. And she was gone for like a week prior to that. So when she came back, she actually explained to us, what is diabetes and all that. The only thing is I didn't remember it because I was in first grade.
Sure,
so.
yes, kind of a long time ago.
And then also, a coworker of mine at a cabinet shop that I worked at, he had type 1 diabetes as well. And I would just notice that he was always drinking, diet pop instead of pop with sugar. And he would always, go to the bathroom right after eating to take his insulin.
Okay, so he always went and kind of did it away from the public. Okay, cool. So Amy, were you at all nervous when explaining what you do, what type 1 diabetes is all about when you first started dating Paul?
No, I've never really felt that way about having diabetes. I kind of like explaining it to people. So I actually made like a diagram of diabetes with, the insulin opens the key to the cell, and I think it really helped him to understand.
It was very detailed, and I suddenly understood it a lot better. Than
I just want to say, from knowing Amy as well as I do, this totally makes sense that she did something like that. That's really cute.
Yeah.
Oh man, I'd like to see that someday. If you still have it.
I actually looked for it and I couldn't find it.
Oh, that's really cute.
But I'm pretty sure it's somewhere.
I'm sure my husband wished I had explained it thoroughly. Did you at all worry that living with type 1 and the stuff that comes with it would affect Paul's opinion of you or your relationship at all? I
didn't worry about his opinion of me so much, but just, it does, having a chronic illness puts stress on a relationship and, financially and emotionally and all that. So there's still that kind of worry in the back of your mind that, it's just an extra thing to have to deal with, but,
yeah.
We're good.
Yeah, we're good.
Yeah, you are. You both are good, I can tell. So either can answer or both can answer. What advice do you have for other couples out there, maybe a new couple where one is a type 1 diabetic?
Yeah, I'll start. One thing that you want to do for sure is, give your type 1 diabetic partner some space. I know I worry quite a bit about did she forget to take her insulin? Did this happen?
Yeah.
Because I forget everything, so I just assume she's going to forget everything too.
I would, sometimes I'll inject myself right in front of him, and 2 seconds later he'll be like, oh, did you take your insulin?
Yeah,
and so you kind of have to trust and every once in a while saying hey, did you take it? Because you really don't know if they took it or not. It can be helpful sometimes, but the over worrying can be really annoying for the type 1.
I think having a conversation about that communication and how that works is a good place to start, and keep that conversation evolving. Because at first I needed more reminders that I needed to test, or did I take insulin and all that. But now I'm a little bit better about it, so it's not as necessary, and it doesn't help me.
You don't need reminders all the time.
Yeah, now it just annoys me. So, and we're pretty upfront. When he gets on my nerves, when he gets on my nerves, I say, okay, no, stop.
Yeah.
So
that's good.
Let's see. Some other information, I suppose, is just that. I lost my train of thought. Right.
That's okay. That happens to me quite often, almost all the time.
I think it's really helpful for me when Paul educates himself, too.
Yes.
I think doing that is important.
I actually remember being so touched when my husband, when we were dating in the beginning, how after the first couple of dates, I told him about type 1 diabetes, and I remember him telling me later that he'd been looking it up online and researching it, and I was just like, oh, That's so nice.
Yeah, that's helpful.
Because it feels, I know that you agree with this, it feels like so many people don't educate themselves. They don't know what it's like or what it's like to just live with that every day.
Yeah.
Yeah. Well, I think Paul is an excellent example of a T3.
Well, thank you.
And I really appreciate you guys being here today.
Yeah, no problem. Thanks for having us on.
Of course.